Good afternoon. My name is Damian Davis. I'm the Chief Investment Officer, Managing Director, and Senior Portfolio Manager at Brown Capital Management. We could not be more proud to support the American Heart Association and to be the presenting sponsor of today's Watkins-Saunders Award program. Congratulations to this year's honoree, Dr. Yvonne Commodore-Mensah, for all that you do to advance equitable health in Baltimore, throughout Maryland, and around the world. Thank you to everyone joining us today. And please consider making a gift in honor of Dr. Commodore-Mensah to show your support of the mission of the American Heart Association to be a relentless force for a world of longer, healthier lives. And without further ado, please enjoy today's programming.
So in the U.S., we know that there are profound disparities in heart disease and associated risk factors. For instance, Black people are more likely to die from heart disease than their white counterparts. But as I was a PhD student at Johns Hopkins and I took a lot of courses in epidemiology, over and over again I heard that Black people are more likely to have hypertension, diabetes, chronic kidney disease, you name it. So at that time, the way in which these disparities were discussed, the focus was on Black versus white disparities. And as an African immigrant, made me question whether I was bound to develop heart disease because of my skin color. And so I dove right into the literature to understand, what do we know about heart disease in African immigrants in the US? And to my surprise, at that time in 2010, there were no published studies looking at heart disease and risk factors in African immigrants in the US. And so that's when I said, that's it. That's what I'm gonna spend the rest of my career doing. My love for heart health started in college. In my junior year of college, I took on a position as a nurse extern at Hackensack University Medical Center in New Jersey. After graduating from college, I took on a position as a cardiac nurse at Inova Fairfax Hospital in 2008. And again, that's where my love for heart health deepened. But that's also where I, again, got exposed to disparities in heart disease. So for the patients who came in with heart attacks or different cardiac procedures, they were often people who were Black or Hispanic, or when you looked at people who were often readmitted, it was often people from racial and ethnic minoritized groups. And so that begged the question, why do these disparities exist? And I decided to go back to school to study disparities in heart disease, but also to gain the skills to design interventions and programs to improve heart health.
I first met Yvonne when she visited the Johns Hopkins School of Nursing to interview for our PhD program. From the very beginning, it was clear to me that Yvonne was not only bright, but friendly and really highly committed to improving cardiovascular care and driving cardiovascular health equity.
I first met Yvonne when she was a student at Johns Hopkins School of Nursing. She stood out quickly because she has a wonderful way of establishing eye contact with people and engaging them in a conversation where she is fully engaged. She's eager to know you and to know what you're interested in. And she's also always interested in learning. She very quickly became attracted to the group of us that were working as faculty and students on cardiovascular risk reduction. And I was the principal investigator on a study called the Young Black Male Study. And we were interested in why it was that the high blood pressure control rates were so poor in diagnosis and treatment in young Black males, and recruiting men from the community to be in what turned out to be a 5-year study.
I have known Yvonne Commodore-Mensah since 2010. I first met her when she came to Johns Hopkins to begin her doctoral program at the Johns Hopkins School of Nursing. And my first impression of her was that she was incredibly smart, very enthusiastic, and just passionate and innovative about improving the cardiovascular health of underserved populations.
Dr. Lisa Cooper is one of the people that I was very fortunate to be mentored by. And I remember walking into her office to talk about my research ideas, but also reading about her work and the groundbreaking work she had done over her career to really shed light on these disparities. But what also excited me was that she was actively designing programs to do something about it. So not just describing the disparities, we know they exist, but we know enough to do more to close these disparities as well.
I think someone had told her that I was also from West Africa. You know, she's from Ghana and I'm from Liberia. And they had told her that I was interested in studying the cardiovascular health of underserved populations. So she made it her business to come over and meet me. And I couldn't have been more excited because, you know, as an African immigrant myself, I had always been interested in studying the health of African immigrants, but I actually hadn't done that. But she talked about that for the first time, that not only was she interested in studying marginalized groups, but particularly African immigrants and other people of African descent.
She wanted to look at immigrants in Baltimore and in Washington, D.C. And she knew that the place where she was going to find them to recruit them to the study was not going to be in the doctor's office because they weren't there. It was going to be to go out into the community and find them where they were. She recruited nursing students and medical students and trained them in how to do screenings in communities. They went to churches in Baltimore and in Washington, D.C. on Sunday and collected their participants, and they then collected the data. This was one of the very first studies done on a population of people who had emigrated to the United States. And we were looking over time, it's well known that they acquire more behaviors of the United States, the kind of foods they ate, for example, and the extent to which they exercised. She was able to adapt the previous methodologies with some changes to the immigrant population. And it was one of the first people who had ever done that with young men and going into the churches, into the community.
Her tenacity was clear from the very beginning as she was designing a dissertation study. She very astutely assessed the gap in the science, and she conducted a prospective survey of over 400 African immigrants in the Baltimore and Washington, D.C. area. And she did this with such a high level of independence and exceptional talent. She assembled a group of fellow PhD students and master's degree students and colleagues to work with her closely. She was very powerful in her approach to engagement to get others on board with her study. And when I mean engagement, I'm talking about engaging faith-based leaders, engaging colleagues who were partnering with her and helping her to conduct the study, and engaging patients as well. She also garnered support donations for some of the testing that she was conducting. And at the end of the day, she conducted, as a doctoral student, the first study of cardiovascular risk among African immigrants in the United States. And I think that's just a perfect example of Yvonne. She was a PhD student, and yet she had the incredible brilliance, she's intelligent, to design a strong, a robust study and to achieve what many might think is not feasible for a doctoral student. She did it, and she did it very well.
And we worked on a paper that talked about using community engagement to recruit African immigrants for research. And then we subsequently went on to do something that I think has been one of our most exciting projects, is this project where we took some of the work that we had done here in Baltimore around improving hypertension care for African Americans. And we used some of the learnings from that and also developed a program that we tested in Ghana. And she led this project called the Adinkra study, which we did in Ghana. We first did a pilot version of the study, which showed incredibly wonderful results using nurses to work with patients from underserved groups, and also using mobile phone technology, so an app to actually help people measure their blood pressure, record when they were taking their medicines or not, and then communicate with their nurses so that they wouldn't have to travel back and forth to the clinic and, for example, wait all day. So that AGINCRA trial has been one of the real exciting projects that we worked on.
I met Yvonne back in 2011. At that time, she was doing her PhD at Johns Hopkins. So she reached out to me because I've already started doing a lot of work on migration and health. So she wanted to link up to learn more about what I was doing and also for a potential collaboration. And immediately I spoke to her. I realized that, yeah, she's got what it takes. She had a lot of energy. She really had a big ambitions, maybe to make a difference. And she is incredibly committed in giving into the community. You know, you can do the science, you can get it published, you can become famous, but at the end of the day, it's the patients and the community that matters. And therefore, it is very, very important that we prioritize it. You know, we need to take the science back to the community, explain it very clearly, simply, so that the community can understand it. Once we achieve that, then you can make a whole lot of difference within this community. And more importantly, these communities often, especially many of them are in a vulnerable situations. And as a result of that, trust is always a big issue. So by engaging with these communities and really making them feel that, you know what is going on, you build trust and make it a bit easier for we, the scientists, not only for her and others, but also for colleagues to be able to penetrate through these communities. And I think this is really, really important. And then for that, she's doing a very, very good job in that regard.
My favorite part really is being out in the community. So a lot of my work takes me out into the community, whether it's faith-based settings or community-based organizations where I get to talk about heart health. And I spend more time engaging with communities that are disproportionately affected by heart disease, so Black and Hispanic communities, in terms of engaging them to understand their awareness of heart disease, screening for heart disease risk factors such as hypertension, high cholesterol, but also doing a lot of education. Really, that's when I come alive, when I'm in the community and talking about what it means to have hypertension and how one can prevent hypertension and heart disease in the first place.
I like to tell the story of how, especially when we would do work in faith-based organizations, and every Sunday, Yvonne will be there with the rest of the team, and all of us will be there almost every Sunday for a whole year plus, doing our data collection and conducting the study in the churches. The key point I do want to highlight is it is very rare to see principal investigators. You know, they're very busy and there's a lot going on, but someone who would, no matter how early, get up almost every Sunday to be there with the team. It's not very common that we see that. And I think just her modeling that has also just transformed how I approach this work, which is you've got to go all in, you've got to be there, you've got to show up.
And a lot of the work that I've done with Dr. Commodore-Mensah, we've had a lot of listening sessions with community partners about what they are struggling with, what are some ideas that they have that might be able to be solutions for these problems, and how we as partners can help them meet those goals. And so really having these community-led solutions is something that's important to us. And we find that this leads to better outcomes because it's something where the community members have had buy-in from all stages of the research process. So not just during the participation phase, but in the beginning when it comes to conceptualizing the idea, to implementing, and then to disseminating it. And so with everything that we do, once we have a deliverable like a manuscript or an abstract, we invite our community members to be a part of that because this is their work and we want to make sure that it's reflective of what we all hoped to accomplish with these projects. And so those are some things that Dr. Commodore-Mensah has really instilled in me, is the importance of doing this community-based work and really centering all of our efforts around the community's voices.
Yvonne's work has been landmark. She has recognized the importance of team-based care in clinical medicine, but more importantly, the fact that we all live in a global community. Yvonne has been able to take concepts that have been developed by the American Heart Association and other professional societies, including the nursing societies for which she has been recognized, not only to the United States, but globally, involving programs and clinical research in Africa to inform how people can prevent cardiovascular disease no matter where they live. Yvonne's work has focused mainly on the social determinants of health, where people work, live, play, and pray. And she recognizes that it's not enough for us to wait for patients to show up in the clinical setting or the acute care setting before we intervene. The best approach to preventing the global rise in cardiovascular morbidity and mortality is through prevention. And this has been perhaps Yvonne's greatest strength.
Some people use the term community-based participatory research, which means that before we even design a study to improve the heart health of a population, we need to engage the community. We need to ask them what matters to them. And that's a very different approach than sitting down, writing a grant, coming up with a solution and saying, here, I have all the answers, I'm going to save you. Community engagement acknowledges that the community has assets. They know what they need. And so before we embark on any research project, we need to engage with community leaders. We need to form community advisory boards that will inform us throughout the whole research continuum, including conceiving the research question, submitting the grant, winning the grant, and actually implementing the project. So it's having the community in mind from the beginning to the end. And what does the end look like? And often as scientists, we focus on publishing papers, getting the papers published in high impact journals, but those types of approaches may not be as meaningful for the community. So with things like community advisory boards, the academic community can work hand in hand with the community to solve a lot of public health problems.
I'm a clinical cardiologist and I focus on women's cardiovascular health, especially pregnancy-related cardiac disorders. There was a grant opportunity that had come up and I was finding a really hard time working up a collaborative team in my own division. And so I had reached out to Yvonne, I was very inspired by her work, and I had reached out to her as somebody whose work I had admired and seen and had a lot of synergies with my own. And it's been a tremendous boon and a blessing to my career. She really was wonderful in helping me put up an American Heart Association grant, which was successfully funded now for about 5 years. And it's been remarkable because through that, I got to know her as a friend. I got to know her as a colleague. I got to know her as a clinical investigator and a scientist that she is, and admire her even more now. This grant was looking at women from Baltimore area and greater Washington area that were young, women of reproductive age, as we call it, 18 to 44 years of age in general, who had accrued cardiovascular risk factors and not necessarily really focusing on cardiovascular health or heart health, and really understanding what were their social determinants of health that impacted their adverse cardiovascular health. So it was understanding of participants' lived conditions, their environments, barriers to health, and attaining care that they needed, and then trying to optimize their cardiovascular health through information and increasing their health literacy. The goal was to include women from underrepresented backgrounds and populations so that we can truly understand the barriers to attaining optimal health in such young patients. Like I mentioned, I being a clinician and a cardiologist, I really learned so much from Yvonne and her team, how to meet people where they are, how to really drive community engagement, how to build trust, how to improve community participation through building trust and ties and long-term relationships with the community, and really focusing on giving more than getting. And I think that, Yvonne's lens of equity and trust and personal understanding of the populations that are impacted by health disparities, I think was hugely beneficial to the grant. But more importantly, I think I learned a lot from her in the dialogue that, was carried out with the team members, with the research team, with community-based organizations that we leveraged, and how to really look at community engagement and community as their own unit in research, and how to incorporate their voice, how to incorporate their sensibilities, what they think is important in the grant writing as well as grant administration, so that it's truly equitable care and you're advancing care through the lens of community engagement.
So it's been a real honor to have met Dr. Commodore-Mensah as a trainee when she started her career at the Johns Hopkins School of Nursing. I have had a chance to see her work and get to know her better through our volunteer activities at the American Heart Association. Yvonne, as a nurse scientist, has reminded us every day why it is that we enter academic research. She's never really shied away from the complex issues that has her working at the intersection of the clinic, research, and community when we think about cardiovascular health and, social justice. I think the more complex parts of her work is that she goes into communities, she listens to voices that may often feel unheard, and she has the scientific rigor that studies of health disparities need, and it's partnered with that compassion for community. This isn't an easy task, and you see it over and over in her work, where she and her research teams are mentoring emerging scholars. They're really putting together interventions that are culturally responsive and doing this landmark research that includes African immigrants. And she does it with such clarity and with such courage and really with a great deal of conviction. It's our hope that when we do our science, that it doesn't just, sit in a journal on a shelf. We really want that science to be able to have an impact on the lives of people in communities. And, as we've been building our research agenda around African immigrant health and African refugee health, we've been looking to what Dr. Commodore-Mensah and her team has been doing. In the city of Baltimore, you can see her work being taken into consideration as we think about how do we include certain measures of people's social status into clinical encounters, and how do we think about the measurement of health outcomes such as blood pressure for a more diverse community than we may have been thinking about in the past. And it is the ability to shift how we ask questions, when we ask questions, and why we ask questions that has really been one of the hallmarks and beauty of the work that she's doing.
When I heard of health disparities being discussed, we would often say Black people are more likely to have XYZ. And then we would ask the question, is race really a real construct? And I think there's greater recognition that it's a social construct. But when we talk about these disparities, more and more people are going a step further to talk about why. So when we say Black people are more likely to have hypertension or diabetes, we follow up with because of differences in underlying social determinants such as the conditions in which people live, play, work, pray. When I reflect on the narrative about health disparities, often people like to think it's us versus them, that Black and brown communities that are affected by heart disease and these other conditions. But here's the reality, we all pay for it. Unfortunately, these health disparities cost the US and cost everyone hundreds of billions of dollars every year. And so if we want to move forward as a society, we need to find ways to ensure that we level the playing field. One of the basic things that I think should happen is that every adult in the US should have access to basic health care. What do I mean by that? If we know that, for instance, hypertension really is a leading risk factor for heart disease, kidney disease, strokes, we want to focus on addressing, for instance, hypertension as a risk factor. And so one of the ways that we can advance equity or eliminate disparities in hypertension and other heart disease risk factors is really redesign our healthcare models and specifically primary care. So if someone has difficulty coming to us, we can go to them. We can engage community health workers. We can take advantage of technology. Most people have smartphones. We know that telehealth was one of the ways that we were able to provide care during the COVID-19 pandemic. We shouldn't roll back a lot of these policies that improved access to care. So my wish is that we reimagine a new healthcare system that is more convenient for most Americans so they can get care where they want, right? And care that is culturally appropriate, care that is convenient, and care that also focuses not on sick care, but preventing the occurrence of these conditions in the first place. We spend far too much money in treating a lot of these complications and underinvest in preventing these conditions.
So Yvonne and I go way back, probably about 32, 33 years back. We actually went to kindergarten together, all through primary school, junior high school, senior high schools. One of the things that I picked up about Yvonne when we recently reconnected a couple of years back was her passion for reducing the burden of cardiovascular disease in Africa and among minorities. I realized that every time I had the opportunity to interact with Yvonne, she had all these ideas of things that we could do in terms of research to find answers to some of the burning problems with cardiovascular care in Africa. And so she's somebody who connects people across board all the time to try to do this work. So I think a lot of what we've done together has been sort of brainstorming, trying to think through how we can improve the quality of care. I know that Yvonne is working to increase capacity amongst nurses to diagnose cardiovascular disease in Ghana, and I'm privileged to be part of that conversation. And also, like I mentioned early on, to bring hypertension care to the next level in Ghana and other African countries, Nigeria, Liberia, and providing facilities like mobile health and then remote monitoring for patients with uncontrolled hypertension. And I think that this model is quite innovative as it is going to change the face of hypertension care and bringing people much closer to care providers and also shifting the burden of care from physicians and cardiologists to nurses who can easily be trained to titrate medications for hypertension in areas like Africa where we have limited skilled personnel to take care of people with hypertension.
One of the unique aspects of Yvonne is that she does the work. Yvonne's charge for health equity spans the globe, not only here in the United States, but in Africa. She recognizes that we're all in a global community, and it is her leadership, both in the American Heart Association and the Preventive Cardiovascular Nurses Association, which has been a shining light on how we can do better to prevent the #1 cause of death and disability in the world, cardiovascular disease. Her charge for health equity fulfills the promise of preventing cardiovascular disease regardless of race, ethnicity, socioeconomic status, immigrant status, sex, gender, or geography.
Yeah, I think that, her work has actually have influenced a lot, because I think at the moment she's one of the very active scientists working on the African population in the US. I think I can say it boldly because she's been very, very active in terms of cardiometabolic conditions. And the work that she's doing, we are all making use of it here because it helps us also to understand what is going up there. She's also been very active, also doing a lot of, the knowledge that she has accrued, actually using it also to do interventions, both in the US and also within the African continent. So the work is already having an impact. And she's also involved in many guideline development, which is actually really, really important because that is actually, in other words, giving the scientists the opportunity to really make a difference on the ground in terms of clinical care. She has been also very, very active, mobilizing healthcare professionals across Africa and really bringing them on board in order to think together and also to see how they can help healthcare delivery within the US, but at the same time also where they are coming from in this situation within the African continent, particularly in Ghana. So yeah, I think she's been incredibly productive and incredibly influential across the global level.
We went to high school together, both came to the United States around the same time for undergraduate studies. And I went on to become a nurse practitioner. I was working in a critical access medical area. And Yvonne went on to get her PhD at Johns Hopkins. And she was always encouraging me to go ahead and get a PhD too. So I decided to do that. And we have been working very closely ever since. It's been really an honor working with her. It's been very refreshing. She is a very dedicated person. She's also very detail oriented. I just love the refreshing insight that I get from working with her. She is a really good leader, leading several of these projects. As you know, her work spans both locally and globally, or global, as she coins it. And so, working here in the United States as well as internationally, she just was able to get some funding to expand the work of Adinkra to other African countries, including Nigeria and a few others. It's been a really good opportunity working with her. She has opened doors for me that I didn't realize I needed open for me. For example, just flying all the way to Ghana for this project, meeting with people on the continent, just bringing together people who were in health, who were in industry, for example, who were in academia, and also the clinicians, whether it was the different levels of nurses, physicians, and then other advanced practice providers, midwives, for example, even for this project, and working not only in Ghana, but also expanding it internationally, looking at hypertension protocols and what is done in other countries, what has been feasible, what has not been feasible, and then incorporating it into the study. And then working all together to publish this, bringing people who were, working on the ground with the patients, with the different hospitals in Ghana, just bringing them in to the project and all working together to publish, for example, to disseminate the work that has been done in different areas has also been very insightful and a really good learning experience from her.
What really separates Yvonne from other people, I would say, is being a genuineness, care, a kindness. It comes true. With her, I'm never unsure. I'm never uncertain. She is gentle. She is kind. She is human in the true sense of that word. I think it's a miracle, really, that I met her. I think she's one of those people, and I think we've told her this as well, that she's one of those people that you sort of meet once in a lifetime. It's rare to find someone who is that interested. And a lot of mentors try to create that dichotomy. You're professional and some things are personal, but she has the skill and she has this ability to recognize that we are humans first, we are persons first, and that we exist, and sometimes bring all of that humanness to us, and she takes all of that. I don't know that there are other people, and I like to say I've worked with other mentors and they have their very unique qualities as well, but this is one that is extremely unique to Yvonne. She's very kind, committed, and devoted to people around her, to her mentees in particular. She definitely gives her all. She doesn't hold back at all.
I think that one of the big things about Yvonne is how she opens her arms readily to young people who are interested in research. Like I said, she's a big encourager, she's a big motivator. Even though she's really busy and saddled with all these responsibilities, she makes time to pull people up with her. She's somebody who makes time to brainstorm ideas. She follows up to see how it's going, and then sort of gives people the push to do a little bit more. I guess she's someone who sees the good in everyone who has the desire to work with her, to do meaningful research, and that's something that is really commendable. It's also partly probably responsible for all the feats that she has chalked this year, and all this while in this space of research.
Her leadership is not just about scientific rigor, it's about improving the heart health outcomes for those who need it most. And so her life's mission has really been to support others, to innovate, and to ensure that communities who have long been overlooked are finally seen, heard, and cared for. And she uplifts everyone around her and makes space for others to thrive. And she doesn't just seek credit, she seeks impact and meaningful change. And so she is someone who is most deserving of this award because she has been able to advance health equity, not only locally in areas and communities like Baltimore and Washington, D.C., but globally back in her own community in Ghana and other communities within Africa.
You know, just as Doctors Watkins and Saunders were these amazing champions for health as a human right, I think Dr. Commodore-Mensah's work moving forward is going to bring to the foreground that equity is really a moral imperative and that it's something that should be a part of everything that we do. The research that she does around blood pressure management or, cardiovascular health promotion, when we see how that gets so seamlessly integrated into how we can think through clinical operations, we know that she's onto something really special. I think our superpower is when we come from backgrounds that are different from what we see in our academic settings, and we can muster up the courage to break through and to bring voice to some things that haven't been discussed before, to do the research in a way that people haven't tried before. And if you watch Dr. Commodore-Mensah, you will see that Yvonne is uniquely gifted at bringing the voice of people who've previously not been seen in our work to the table and really doing some important work that helps us to advance health justice for all people. There's so much about her to love.
I personally knew both Dr. Watkins and Dr. Saunders. Dr. Watkins in his pioneering work in cardiovascular surgery, and Dr. Saunders in his work going outside the clinical setting to start to address prevention in novel settings, including barbershops, beauty shops, and churches. To a large extent, Yvonne represents the best in the Watkins-Saunders approach, merging advances in clinical medicine with new approaches in cardiovascular prevention in the community settings.
Yvonne was just such a clear choice for this because I use the word relentless force, but I just love the AHA terminology of relentless force. She's truly been a relentless force in championing health equity, and she's really driving things in innovative directions. So I think her body of work and accomplishments, together with her character, everything about her, I think, made her the ideal choice for the Watkins-Saunders Award. It's tremendous. She's on clearly a meteoric rise in her career and the impact she's going to have. So I think she's receiving this award still at a relatively early stage in her career. She has so much more she's going to do and accomplish. So I think she's receiving this award in very well-deserved recognition of all of her accomplishments to date. But I think it also just marks the end of the beginning of her tremendous career. There's a lot of great things ahead. And I think part of what we consider it as a committee is the tremendous trajectory that she's on.
It is my absolute honor and privilege to recognize an extraordinary leader in advancing equitable health, Dr. Yvonne Commodore-Mensah, as the 2025 recipient of the American Heart Association's Watkins-Saunders Award. Dr. Commodore-Mensah is a trailblazer whose work has transformed how we understand and address cardiovascular disease in African and immigrant communities. Her research, advocacy, and leadership have not only advanced science, but have also brought hope and healing to countless lives, both here in the United States and across the globe. As a nurse, epidemiologist, educator, and mentor, she exemplifies the spirit of this award, named in honor of two pioneers in equitable health, Drs. Levi Watkins and Elijah Saunders. Her commitment to community-engaged research and her tireless efforts to eliminate disparities in care are exactly what this award was created to celebrate. On behalf of the American Heart Association and the entire Eastern States region, congratulations, Dr. Commodore-Mensah. We are inspired by your vision, your passion, and your unwavering dedication to building a more equitable world.
Hello, Yvonne. Today, I've heard about this wonderful achievement, and I would like to take this opportunity to congratulate you. You are incredibly, incredibly proud of you. You've achieved a lot. What I like particularly about you is the energy that you bring, in the room. You do science not because of the, fame, but you do science because you want to make a difference to the society. And it's brilliant to see all the achievements you've made. And I look forward to continue to work with you in the coming years as a colleague. It's been a pleasure to get to know you, and I wish you all the best in the coming years. I think you have a lot to offer to the world. You've just begun, and I wish you all the success.
Yvonne, congratulations. You make all of us at the Johns Hopkins School of Nursing so very proud.
If there's anyone who truly deserves the Watkins-Saunders Award, it's you, Yvonne. Embodiment of just genuine kindness, care about health disparities, and you back that up by action in the work that you do, in everything you say, in your mentorship. Everybody around you knows that you're truly deserving of this award. Congratulations on the Watkins-Saunders Award, truly deserving. And I'm so happy for you and all of the achievements.
Yvonne, I am incredibly proud of you. I am so happy for you, excited for you. I'm just in awe at what you have achieved, just being the American Heart Association Watkins-Saunders Award winner, just looking at what you have achieved at such a young age just warms my heart. I am so excited. There's no words for me to explain or to show how I feel. Excitement is the least thing I could say, but go on, go forth, and continue to break barriers. I love you, girl.
Yvonne, I can think of no one more fitting for the Watkins-Saunders Award. You are, in many ways, just like the pioneers for whom this award is named. And it's been amazing watching your career unfold. You have been so courageous, and the work that you're doing is incredibly important. And I hope that you will continue to do all that you can do to move things forward in the wonderful way that you have been doing. I just want to say, I hope that your heart will continue to lead our hearts towards a more just and wonderful world.
Yvonne, I'm thrilled that you have received this recognition for your good work, for the quality of your work, for the amount of your work, and for the relationships that you've been able to establish with people all the way from the top of the Heart, Lung, and Blood Institute, the American Heart Association, Johns Hopkins University, and beyond. It's making me feel wonderful to see how you have been so accomplished and enjoyed it so much. You're being thrilled by the wonderful work that you've done is a thrill that all of us share. And so congratulations.
Hi, Yvonne. Congratulations on being this year's Watkins-Saunders Award recipient. I'm so proud of you. I'm not surprised at all. You've worked so hard all these years, pushing the agenda of improving cardiovascular care amongst people living in Africa, amongst minorities. And your research has translated into, many positive outcomes and impacts for people in Africa and among minorities. I want to take this opportunity to congratulate you. I know that this is just the beginning of greater feats to come, and I look forward to celebrating many more of such in the years to come. Congratulations, Yvonne.
Congratulations, Dr. Commodore-Mensah, on this amazing achievement and being honored by the Watkins-Saunders Award. You are truly the most deserving individual for this award, as you have dedicated your work around uplifting those that need this work the most. And so I am deeply honored to witness you achieve this incredible accomplishment. And I look forward to all the amazing work that you will continue to do. Congratulations.
Congratulations, Yvonne, on this wonderful honor. I couldn't be happier for you. This is such a wonderful tribute and a true recognition of all of the amazing work you have done in advancing care of people that are impacted by inequitable care. Personally, for me, I am delighted to be a friend of yours and a collaborator. I have learned so much from you, and I couldn't be more happier for you. Congratulations again. You truly, truly deserve it.
Congratulations, Dr. Yvonne Commodore-Mensah. I'm so happy for you to receive this very well-deserved honor.
Yvonne, well done. You are such a wonderful person and so deserving of this amazing award. Congratulations from me and all of your friends at PCNA.
Yvonne, you know I'm a serious warrior and a champion for change, and so are you. I applaud you on this award. You represent the best that we have in nursing and medicine, and it's through your research and work that the world will be a better place in the future. Yvonne, thank you for all you've done. You clearly fulfill the ideals of Watkins and Saunders, and this award is befitting of your work to make the world better for everyone, regardless of where they reside.
Congratulations, Yvonne. I am so thrilled and happy for you. Well deserved.
It's hard to put into words how deeply honored I am. I remember when I attended the Heart Ball when Dr. Lisa Cooper won this award about a decade ago. And I remember sitting there and just feeling so happy for her. And as a mentor, I've always looked up to her. I recognize that this award honors the memory of two giants in the cardiology field. And these are people who are not just committed to their professional identities, but they were people who fought for equal rights. There were people who fought for enhancing diversity in the cardiology workforce. They were servants. And so I'm honored that the American Heart Association thinks that I am deserving of this honor. But what I hope that this does is that someone like me sees this and knows that they too can accomplish anything they set their hearts to, that their dreams are valid. They can do things their way and still have meaningful impact. And most importantly, that you're never too young. And I've been very fortunate to be surrounded by, I call them legends, who look at me and never try to dim my light, who always find ways to elevate me. And so I really hope that through this award I can inspire others who may or may not look like me, but really want to live a life that touches others and leaves a mark. I hope that at the end of my career, I would have added value to other people's lives. And this award means so much to me. And so I'm deeply honored and grateful to be awarded the 2025 Watkins-Saunders Award.
Both Dr. Watkins and Dr. Saunders would be thrilled to know that she was receiving this award, because she truly embodies all the things that they stood for and that they worked for. To see her sort of leading the next generation of people doing this work, I think would be something they would both be incredibly happy to see.